Learning outcome 3, be able to assist with diagnostic procedures, assessment criteria 3A to 3E. Learning outcome 3, aims and objectives. Assist with positioning of animals for diagnostic imaging, select exposure settings and positioning aids, work safely within the current ionising radiation regulations, demonstrate cleaning diagnostic imaging equipment, and identify images of diagnostic quality. Maintain commonly used radiographic equipment. In your workplace, you will need to be able to repair and maintain commonly used equipment, such as the X-ray machine, film, cassettes, and processor. You should be aware of how to sustain consistent X-ray images by efficient maintenance procedures, and all manufacturer's instructions should be followed along with any local practice policies. Maintaining equipment in this manner will also prolong its expediency and efficiency. And periodic maintenance, such as cleaning and intensifying screens, should also be included. Maintenance of the X-ray machine. Servicing of the X-ray machine should be carried out at least once annually, and this means that the machine will be checked to ensure it is fit for purpose and safe for the personnel using it. In preparation for use of the X-ray machine, they generally need to be turned on to allow them to warm up, ready for use. Prepare and maintain film. If using cassettes that require film, the film must be stored in a light-proof box, generally its original container, and be stored in the dark room to prevent any exposure to light, as it is light sensitive, and your dark room will be light-proof. Some process may include an aspect which allows you to place your hands inside to place film in cassettes, again without exposing to light. Unexposed films and loaded cassettes should also be kept away from the exterior area, as they could have some degree of what we call scatter radiation reach them, and this can cause fogging of the film. We must also take care to ensure that chemicals aren't splashed onto the unexposed film, and boxes of films must also be dated and used in date order to use prior to expiry date. And we should take care when handling unexposed film and placing into the cassette, as you can cause damage such as bending, and finger and nail imprints can also occur. Such preparation and maintenance of film is not relevant if you have digital X-ray. However, not all practices do have digital X-ray, or it may be that you work between different branches and may need to encounter different types of X-ray equipment, so this is certainly important for you to be aware of. Within the actual cassette are intensifying screens, and these screens are an expensive aspect of the cassette and should be treated gently, as they are also reasonably delicate, and any scratches or abrasions can damage the phosphor layer within the intensifying screen. Please see the image below, and that will in turn damage the layer permanently and will produce white marks on all future X-rays. The screen should not be splashed with any chemicals or touched with fingers that are potentially dirty or greasy. Any hair or dust that fall onto the screens will produce white specks on the developed X-ray. And due to this, screens need a periodic wipe over using screen cleaning fluid that is anti-static in a circular motion. The cassette then requires standing open in a dust-free environment to allow the screen to dry naturally. They must be dry, as if reloaded damp, the film will adhere to the screens and damage them. Cassettes themselves should always be treated gently and never dropped on the floor. They should be kept clean on the exterior, as this could cause leakage of fluid inside or shadowing being caused on the image. You must ensure when reloading a cassette that you place the film in appropriately to ensure that the cassette shuts correctly and to prevent damage to both the film and the cassette. Maintenance of the X-ray processor. They generally require a warm-up period prior to use, and this can generally be around 10 to 20 minutes and could potentially take longer in colder weather. Manufacturer's guidance should be followed. If films are processed before the appropriate warm-up time has been completed and thus its operating temperature is not achieved, the resulting X-ray will be underdeveloped. After warm-up, a piece of unexposed film should be passed through to check for the correct functioning of the machine and also to remove any chemicals that could have dried on the rollers. 10 exposures per day is generally required to ensure the appropriate replenishment of chemicals in the tanks, and old films can be used to assist with this. And at the end of the working day, the machine should be turned off and the superficial rollers wiped or rinsed. Weekly maintenance. Once a week a more thorough clean is required. Manufacturer's instructions must be followed, and this is key. A deep sink is a must, as rollers and the whole roller assembly for each of the 3 tanks can be removed and thoroughly cleaned. Old toothbrushes or similar brushes can be utilised to clean all clogs, and the tanks themselves also need to be cleaned once the chemicals have been drained out, ready to be replaced. Millstone can be utilised to remove algae from the walls of the tanks and also the rollers. However, again, manufacturer's instructions must be followed to see whether this is appropriate. When handling chemicals associated with the processor, great care must be taken to remember that such chemicals are irritants, and so personal protective equipment must be worn. This will protect you, and this should also include the use of eye protection to protect your eyes from any chemical splashes. In relation to this type of processor, again, this equipment isn't relevant to digital X-ray. However, again, it may be that you encounter such a piece of equipment working at another branch, or if you move practices, and you will see the difference between the care already that is required between what is not classed as an old-fashioned means of X-ray taking or X-ray developing, but however, a lot of practices have moved now towards digital, but it is still important for you to have this awareness. So the chemicals that are involved in relation to this sort of processing, which we term wet processing, are fixture and developer. They are produced specifically for automatic processors. The fresh chemicals are pumped in for each film and then discarded. The chemicals are made up by mixing concentrated solutions with water, and generally there are 3 concentrates for the developer, and for the fixture there are 2. They must be mixed in the correct order and with the correct concentration of water. For some automatic processors, there's an automatic mixing unit which automatically performs the dilution with water, and this is certainly much safer for personnel involved. Maintenance of the processor. The processor should be serviced regularly, and this may actually take place annually or biannually, so that would be twice yearly, and this will depend on your service company. If you have this type of processor and you're not aware of your practice procedure and how often it is being serviced, it's worth finding out who does this for your practice's automatic processor, as you may be involved in arranging such calls for services to be carried out, or also for such companies to come out if you were to have an issue with your processor. Prepare radiographic environment and equipment for use. It is important that radiographic equipment is prepared ready for use. As already stated, the X-ray machine will require warm-up time, as stated in the manufacturer's guidelines, as will the automatic processor if you use one. It is important that the equipment is appropriately warmed up ready for use to ensure and enable the most efficient of functioning. The X-ray room area will also need to be prepared ready for use. Consider the fact that on many occasions these animals are sedated or anaesthetised for X-ray procedures to take place, and the more prepared we are beforehand, we can reduce timescales of anaesthesia or sedation by having been prepared as best we can. The sort of equipment that you'll need to hand will be the cassette, positioning aids to include troughs, sandbags, foam wedges, ties, left-right marker and pen, X-ray book, X-ray tape if this is something your practice uses, and anaesthetic equipment prepared suitable for the patient. So what preparation is required? The cassette will need to be positioned either on the table surface and a grid utilised, and that is if the area of interest that we are X-raying is over 10 centimetres in thickness. So for example, we use grids as a general rule of thumb for all views other than that of the limbs. Or it may be placed in the bucky, which is a form of grid, and this is under the table. Check to see if this is something that your practice has. The primary beam must be collimated to the smallest size practicable within the boundaries of the cassette, and that would mean within the borders of the actual film, and this is vital to reduce the amount of scattered radiation produced. Details regarding the labelling is vital. In many cases, this will consist of the patient and owner name, date, and potentially a number related to your practice's recording of radiography exposures. Utilising the information provided. Research the labelling requirements in relation to BVA hip skull radiography, utilising both the links to information that is provided from the BVA. Prepare the animal for radiography. Animal preparation is key. Remember, animals are not always anaesthetised. They may be heavily or lightly sedated, and in other cases, if it is contraindicated to do so, such as an animal in respiratory distress, they may be conscious. If the animal is being anaesthetised or sedated, this will all be as instructed by the veterinary surgeon in charge of their care or treatment, and as discussed in previous lessons, as calm and relaxed as this can all be, the better for the patient. Your role will be to support the qualified veterinary team during radiography exposures. Patient preparation continued. Because general anaesthesia is not always utilised during radiography, minimising patient discomfort is vital. This will include correct handling, generally utilising minimal handling during examination, etc., and consideration of safe and appropriate positioning of animals in respiratory distress. Your veterinary surgeon will advise and instruct depending on the patient as an individual, their condition and how stable they are. In most cases, the use of position aids and sedation or GA is used to position patients adequately. Some placid animals will sit still and tolerate sandbags or foam wedges. Always take into account the temperament of the animal. Please bear in mind that it is not appropriate to use ties for animals that are not anaesthetised, as it could potentially cause them to harm themselves, whereas sandbags and foam wedges are far safer to use because we wouldn't be anchoring those to the table. Please note the following. The guidance notes for the safe use of ionising radiations in Veterinary Practice 1999, which are based on the Ionising Radiations Regulations 1999, explain that only in exceptional circumstances should dogs be manually restrained for radiography. This applies to all our small animal patients. You should not be involved in restraining animals, as you should not be within the area of the primary beam when an exposure is taking place. We should be utilising other means of restraint, as already stated, to restrain animals adequately. The patient will need to be positioned appropriately, and the use of positioning aids will assist this and can consist of the following: troughs or cradles, and these will vary in size and are needed for positioning patients on their back. Sandbags, ideally covered in plastic to allow for easy cleaning. These vary in size and are useful for limbs or placing over the neck. They are loosely filled with sand to allow flexibility. They are radio-opaque, so care should be taken to keep them out of the primary beam. Foam wedges can be placed under the chest, skull, abdomen and neck to prevent rotation. They are also helpful for accurate positioning of limbs. Again, ideally cover them with plastic to allow easy cleaning, and they are radiolucent and may actually be within the primary beam. Tape. Cotton tapes or sticky tape can be used, and these can be looped around limbs and secured to sandbags or hooks to the table. Again, care with using tape and ties and securing to the table must only be done with patients that are anaesthetised. Ties. We do use them to extend limbs, and they can be secured to the table. As already stated, do not use with sedated or conscious animals. And the reason behind this is that it could cause the animal great harm if the animal were to panic and to try to get away, i.e. trying to get away from the actual procedure that we're carrying out. If they were tied to the table, they could actually really injure themselves, potentially fracture or break limbs, so we must not be using them with patients that are not anaesthetised. Velcro straps have the same use as tapes, and wooden blocks. These are radiopaque, so shouldn't be used in a primary beam. And we can utilise them when you're trying to x-ray the skull, for example. We place them under the plate to raise it closer to the patient. Wooden blocks aren't so commonly used in practice nowadays, however it might be something that you use on the odd occasion. Focusing on the area of interest. To maximise the diagnostic value of x-rays, patient positioning and accurate collimation are essential. If we have poor positioning with rotation of the area being x-rayed, it will result in it being misinterpreted, which could be very, very poor in relation to being able to diagnose a situation. X-ray cassette needs to be large enough to fit the whole of the area of interest, so for example all of the chest or all of the abdomen, and we must make sure that we use the correct size of cassette consideration of the size of the animal and also the area of X-raying. So if we were to use small plates when X-raying a large dog, again that would make it difficult to interpret. We should place the area that's being X-rayed as close to the plate as possible to minimise blurring and produce a more accurate image. We should centre the primary beam over the area, especially where joints or disc space is focused on. The centre is always the middle of the cross and it is sometimes highlighted by red laser dots. And we should make sure that the primary beam is perpendicular to the plate, as otherwise we could have a distorted picture. Task: research the importance of ventilation in the darkroom in relation to the associated chemicals. Using either the internet or your textbooks to assist you, research the appropriate procedures for manual and automatic processing. Note, many practices no longer utilise manual processing as it's become outdated. However, the specification from your awarding body states it is important for you to know how the process works. Digital radiography is now commonplace within veterinary practice. Research the process of digital radiography in relation to how the image is produced, and please upload this onto one file for your veterinary educationalist to mark. Cross-infection. Remember that you are utilising various positioning aids as well as parts of vital equipment for radiography, as well as cassettes and also the X-ray table itself. As explained in previous slides, it's important to have aids covered in a wipeable surface to enable the removal of contaminants such as bodily fluids in order to prevent cross-infection between animals and also to protect personnel alongside the appropriate use of PPE. Health and safety in relation to radiography task. Using your textbooks and the internet, research the following pieces of health and safety legislation and how they relate to radiography. The Ionising Radiation Regulations 2017. These regulations have superseded those from 1999 and it relates to relevant protection from radiation. The Health and Safety at Work Act 1974 in relation to risk assessment production, COSH 2002 in relation to disposal of waste chemicals, local rules to be displayed in your practice, and X-ray badge monitoring and the purpose of this. Produce yourself a mind map or a table to detail how they relate to radiography and how we must adhere and utilise such legislation in the workplace. Please complete this in a format that you can upload onto one file for your veterinary educationalist to mark. Discuss and look at information relating to the following with your workplace mentor. The risk assessments in place relating to radiography in your practice and where you could access them. The procedure relating to your practice's X-ray badge monitoring reports. The position and wording of the local rules and who your practice RPA and RPS are. Health risks related to radiography. It's important that as a member of the team assisting with radiography that you have an understanding of the health risks associated to it. Exposure of either the human or animal body to radiation is hazardous in nature due to the biological effects that X-rays have upon the living tissues of the body. This occurs due to chemical reactions that take place within the cells. There are 4 properties to be very aware of. The properties of radiation are that it is invisible. It is painless. We term the effects latent, meaning that they are not evident at the time or immediately and may not present themselves until sometimes later. Sometimes this can be as long as decades. Effects are cumulative, and so repeated low doses of radiation may be as hazardous as a single large amount of exposure. It is essential that appropriate precautions are adhered to, following all earlier discussed legislation, and the adverse effects that radiation can have upon the body are divided into 3 types. Adverse effects of radiation task. Research the following types of adverse effects: somatic, genetic, and carcinogenic. Please produce this as a document and upload onto OneFile for your veterinary educationalist to mark. Practical coverage relating to this lesson. From a practical point of view, you are required to assist with positioning of animals for diagnostic imaging, select exposure settings and positioning aids, work safely within the current ionising radiation regulations, demonstrate cleaning diagnostic imaging equipment, and identify images of diagnostic quality, and these activities will link to your online portfolio. In summary, in relation to coverage of this video session and also the carrying out of the practical associated activities, you will have covered all of the points detailed on the right hand side of the slide.